Friends, we're back. Sorry for the technical glitch here. Occasionally that happens. The machines decide to do things on their own, just like computers and laptops and iPads like to have their own mind. Sooner or later, they all will have their own mind, and they won't be relying on our minds. But we have a lot to talk about today. As I started to mention, I don't know who did or didn't hear, but we're going to talk about a few different studies. One of them is really important about growth hormone, or rather growth, body composition, and cardiovascular status of children consuming different types of diets, vegetarian, vegan, or omnivore diets. And we'll talk about that in just a moment, where we see that the bone density and some of the parameters of health are not being improved depending upon what people are eating. Another great study, multiple menopause symptoms linked to cognitive decline. Antidepressants, can they speed up cognitive decline and dementia? It looks like that's true. CPAP therapy for sleep apnea patients may help lower Parkinson's disease risk. Very important. And higher mushroom consumption is associated with a lower risk of cancer. This is from a meta-analysis of multiple studies. Let's first talk about growth and body composition, bone density, cardiovascular risk. This is published in the American Journal of Clinical Nutrition, a very prestigious facility, very prestigious studies come through here. And this has been a terrific journal for a very long time. Peer-reviewed, one of the best that's out there. And this talks about plant-based diets are increasingly recommended. And people are liking the idea of going more towards plant as opposed to animal. And this study, the objective was to compare the difference in body composition, fat percentage, cardiovascular risk, micronutrient status. And as this study progressed, the vegetarians had lower levels of adiposity fat around their legs and around the waist. The vegans had lower fat indices, but both vegetarians and vegans had lower bone mineral content, which is not good. You want your bones to be strong and hard and able to grow and repair. As well, the vegetarians had lower total cholesterol, had lower HDL, which you don't want. You want a higher HDL, and typically that comes from the good proteins. They had lower serum B12 and lower vitamin D, and higher glucose, not what you'd want. You want all your vitamins to be up there. And of course, if I talk to patients and parents, we talk about getting the vitamins on board. It's critically important. And whichever diet you want to choose, you just want to make sure that the individuals, whether children or adults, are super healthy and their vitamin levels are perfect. The VLDL, bad cholesterol, and triglycerides were higher. In looking at the vegans, they were shorter in height. They had a total LDL that was lower. HDL was lower. They had higher C-reactive protein markers, more deficient in iron and B12, higher homocysteine because they're not getting the nutrients as much as they would need, and B12 deficiency, iron deficiency, anemia, low ferritin, all more prevalent in vegans. So typically people look at a diet and say, well, I'm all in. I don't want to have the chemicals and I don't want to have the meat and all the different things that may be bad coming within those foods. But if you don't correct your vitamin levels, you're looking for a big problem. You don't want your bones to be weak. You don't want plaque increase because of the high homocysteine, low B vitamins. So no matter what you do, learn about your body first before you start a diet. This holds true for everybody. You'll be able to pull certain foods out, that's great. But if you're pulling out foods that are giving you some nutrients, you're creating a problem as opposed to helping. Now, granted, I like low carb. I like the vegetarian idea. I think people should be using good protein powders, organic and such. People should be testing their blood for vitamins, making sure that all the vitamins are there. They should be doing exercise. This can work extremely well. For people that don't want to be a vegetarian, that's fine too. You want to keep your nutrient levels up high to decrease the risk of heart disease, cancer, and all the others. So you just don't want to put someone into a position where they're chronically deficient in vitamins or that their body is suffering from nutritional deficiency. Critically important. Okay, phone lines are open. If you'd like to call in to ask a question, you could do so now. 888-420-9272, 888-420-9272. Let's talk about multiple menopausal symptoms linked to cognitive decline. Well, every woman who's ever lived and every woman who knows what their mom went through when they went through menopause, and every man with wife or daughter or all the family can see what happens when those hormones start to decline. And just talking about estrogen, progesterone for the moment, menopause, the receptors on all of your cells, including your brain, need these hormones. Your body did brilliantly well when you were younger and had all the hormones, but as you lose them, each of those tissues starts to decline. Of course, you become less able to conceive or to have a child, but you're going to lose memory, focus, concentration, hair, skin, nails will change. Body fat percentage seems to go up. So we don't want people to go running into a zone or a time in their life where they're unhappy, they're unhealthy, their memory is bad, they're not able to lose the weight. So we look at individuals way before menopause and we start talking about testing their levels beforehand. So I have tons of people that come in that are 30, 40, 50, and somewhere between the late 40s and 50s and 60s is when women typically drop the estrogen, progesterone. But other hormones are dropping at the same time. Thyroid, you need to do a big thyroid panel, 12-part thyroid panel. You can't just do T4 and TSH. You need to look at all the thyroid parameters. You need to look at DHEA, IGF-1, the active component of growth hormone, testosterone. All of these things are important. And as we start to see the decline occur, sometimes just giving a woman a little bit of DHEA will balance the estrogen, progesterone, and testosterone, and that's all they might need for a few years to balance out before they start a bigger drop of the estrogen, progesterone. And of course, exercise is important. Will flood oxygen, vitamins, minerals, and hormones to all your cells. So in my mind, I want to evaluate these individuals before the hormones are completely down and out, and just ease into that picture, and then make recommendations for natural bioidentical plant extract hormone replacement for men and women. And that will keep your body functioning as it did in years prior. When we look at lab tests, the lab will typically have an age range and a range for a hormone or a vitamin, and that range declines as you get older because you expect your hormones to be less from 40 to 50, 50 to 60, 60 to 70, 70 to 80. But do you want to lose function? Do you want to age faster than you should? I don't think there's anybody who would disagree with that idea. In many cases, giving you a little bit of what you've always had and bringing your levels back to where you were 10 or 15 years ago does wonders. For the case of thyroid, it may help with energy, memory, hair, skin, nails, some towards fat burning if you're doing exercise. If you look at testosterone, it's good for muscle strength, bone density, sexual drive and function, mood. IGF-1, talking about memory, focus, concentration, mood, endurance, strength with exercise, fat burning. It's great for your skin, your hair, your nails, lots of different things. So all we're talking about is walking you back to where you had good levels and had better function. So it's no surprise to me that if you have more symptoms of menopause, that you'd have more cognitive decline. It's an absolute. Now, in my world, I don't just look at the hormones because they're not the only controllers of your brain and other parts of your body. We also have to look at heavy metals. Lead, mercury, cadmium, arsenic, aluminum, nickel. These damage your body and certainly damage your brain. Aluminum is directly correlated with Alzheimer's disease and dementia. So you want to look at the entire picture. Get the bad stuff out of your body, put all the good stuff back in. So it certainly makes sense to me that when you're looking at, multiple hormone symptoms, you're looking at multiple hormone decline. And that sets the stage for your body aging faster. We all know somebody who was really sharp and focused 5, 10 years ago, and all of a sudden, they're just not doing well. That's because of the decline of cellular numbers. You're not making as many new cells, and therefore not making the same hormones or neurotransmitters that you made. So extremely common. We will all go through it. Some people earlier, some people later. But the whole idea is to learn first, fix things, and don't let that happen. Don't let that change and make you miserable. Let's see what we have.
Got a question from YouTube.
Yes, sir.
What are the most effective treatment options for sleep apnea? I currently use a CPAP machine, but there are alternate treatments like lifestyle changes, oral devices, or surgical options that might work depending on the severity of my condition? Question mark.
So sleep apnea, for people that don't understand the entire picture, is a scenario when you go to bed at night and you're laying flat on your back or on your side, and the weight of your neck is narrowing down the airways, and as you breathe through your nose, and most people typically would, sometimes you snore, and that snoring and that vibration in the back of your palate and your nasopharynx causes swelling, and then all of a sudden you're trying to take a deep breath and you can't get the air in, so then you open your mouth and you gasp to get the air coming into your body. That's called obstructive sleep apnea. It's the most common type. For many years, doctors and dentists have tried doing different things to correct the picture. And sometimes dentists will make a bite plate device that you snap onto your teeth, and it's upper and lower separated by a little bit of a hinge, and it's meant to pull your jaw forward. Not to make fun of Jay Leno, because I think he's awesome, but he's the perfect example of, a slightly forward protruding jaw. So if you do those devices and your jaw comes forward, you're theoretically opening up the airway to let more air in. In most people, it doesn't seem to work well enough, and lots of patients that I've seen don't get that result. There have been people and doctors that will cut the uvula, that funny little thing hanging down in the back of your throat, to see if that will improve the scenario. I don't think that really works. It's not the easiest of procedures to have done. But the bottom line is, yes, if you have a big neck, your size 16 neck or beyond, then likely you might have sleep apnea. If you lose weight and take some of that pressure off, that can help. And there are people that are 300 pounds that need to lose a lot of weight, and that may help. That may take a while to lose the weight. We may recommend they use the CPAP machine while this is occurring. So we want to be able to improve every part of the picture. A great deal of football players and big athletes and bodybuilders all have sleep apnea because of that big, heavy neck. There are different CPAP machines. There are different devices. Some of them are very small that are easy to use with travel. Some you might leave at home. Some may have a little bit of a distilled water device attached to it to make the air coming into your nose moist. Some people will use masks that cover half of the face. A lot of people don't like that. Other people will use nasal pillows where there's very, very soft, sort of like silicone-like texture devices that sit up against your nostril, and then the strap goes around your head, and it's less invasive or less of something up on your face, which people don't like, and they tend to do very well with that and sleep well with that. So, yeah, of course, the idea of losing weight, the idea of helping to correct and get that air into your system so that you're not snoring and you can sleep like a baby, because letting that air in with a little bit of pressure will stop the snoring. Sleep apnea is also correlated with AFib, heart arrhythmias, and a whole host of other issues. And now it's talking about correlation with Parkinson's, because your brain needs to get good, deep REM sleep to function. And we can't talk about Parkinson's without doing a little bit of a discussion about heavy metals and how heavy metals damage the substantia nigra, the dark part of your brain that controls movement. And we know heavy metals are directly linked with Parkinson's. So whatever works, I think, is a good idea. For the majority of my patients that have sleep apnea, we put them on the nasal pillows. They'll take a little small device called a Bria Z CPAP machine, because you can travel around with it. It's not big at all. It's about the size of a couple of, pool balls side by side. It's not a big device, but it's easy to travel with. So that's probably your best option.
Okay, we got another one from YouTube. What are the main health benefits of antioxidants, and how do they help preventing disease? Are there specific antioxidant-rich foods or supplements that are particularly effective for overall health?
So antioxidants, great question, by the way, are things that decrease free radical damage. So free radicals are very excitable, very reactive, and they damage tissue by stealing an electron. So if there were a brick wall behind me and I'm a free radical and I steal a brick and I keep doing that, the wall's going to crumble because I've just destroyed by taking those bricks away. a free radical will grab an electron on the outer orbit of tissue or the atom, and it neutralizes its own charge by stealing the electron. Loss of electron is oxidation, going back to high school chemistry, which back then I never thought I'd ever need to use that again, but here I am talking about it every day. So what you learn in high school, yes, may be valuable later on in life. So antioxidants stop the free radical from stealing the electron. Loss of electrons, oxidation, gain of electron reduction. Leo says Gur. So the free radicals are bound by the antioxidants like vitamin C and other great nutrients, and they stop that damage from occurring. So vitamin C orally, vitamin C intravenously, any of the other nutrients, a lot of the other minerals, quercetin, a wide range of different things can decrease that damage and can decrease inflammation caused by free radicals. Heavy metals cause free radical damage. Excess sunlight when you burn your skin is free radical damage. Smoking, 4,000 chemicals in cigarettes, free radical damage. The list goes on and on and on. So if we could put nutrients on board that bind to the free radical and stop it, you're saving that tissue damage. So, of course, lots of vegetables, good fruits. Squash has got lots of nutrients in it. So the foods that are the best foods for you are the ones that have the most nutrients, potassium, magnesium, etc. So, but the ultimate antioxidant mechanism is either using a vitamin C IV, correcting other vitamins like D and all the Bs, glutathione, critically important as a free radical scavenger. That we do intravenously because orally it doesn't really do much, because oral glutathione may be broken down by your digestive enzymes and not really get to do anything for you. So it depends upon what people present with, but fixing your vitamins and minerals based upon your blood tests, recommending and then retesting your nutrients is proof that you're getting those into the right range. Pulling out metals, very important way to decrease free radical damage. And bringing in the best and the most healthy organic foods you can, because foods that are not organic are going to have some free radical effect. We've always heard about bacon having nitrates and all. It's just all the chemicals in some of these foods are horrible, so those will create free radical damage.
All right, we're moving. Okay, doctor, I got masseter Botox because I suffer with TMJ and grinding badly. The last treatment I received was 8 months ago, and ever since, it feels like one corner of my mouth is drooping down. Any advice?
Well, Botox is going to, in a way, put a glove over the nerves, so now the nerves can't fire and the muscle now becomes relaxed. Sometimes doctors put it in the wrong spot. Sometimes too much is used, so you have to be very careful with that. When doctors learn how to do Botox, certainly around the face, around the eye, you're not allowed to go too close to the brow and to the midline. There are diagrams that tell you where you should and shouldn't go. It's hard to say or to tell you what else may be contributing to your TMJ. There may be issues within the jaw that sometimes are connected to the way your head sits on your neck, and we refer a lot of our TMJ patients to osteopathic doctors like Dr. Simone, who can do hands-on osteopathic technique with traction and stretching, and a lot of people do really well with that. They also do well with tinnitus as a result of those techniques. Some people might use either mouth guards that dentists make, or some people will use the trays that you use for whitening your teeth. They may not put the whitening gel in it and just have those in their mouth when they sleep, and they have that comfort, they have that cushion, the protection, so they're not really grinding down and putting a lot of pressure on their teeth. So there are different mechanisms that may be at play. We've had some people that we've done PRP, where that helps to create some strength and stability in those tissues, but you would need to look at an MRI to see exactly what's happening in the TMJ, in that joint.
All right, we have, does current cancer research include stem cell therapy as a potential treatment, or is that not
Absolutely.
Yet?
So for many years, stem cell therapy is used for cancer. They just call it a different name, a bone marrow transplant. So what's in your bone marrow? The greatest things in your body are in your bone marrow. That's where your immune cells start, your blood cells, and your stem cells are in your bone marrow in the largest amount. So, yes, they've done for a very long time bone marrow transplants or they'll put a patient in a hospital for 3 or 4 weeks, again, depending upon their circumstance, which type of cancer it is. So the oncologists work that entire picture out. They may extract the stem, they give you chemo and radiation, and then put the stem back in to repopulate, what they would like to think is a healthier and better immune response. So yes, that's been ongoing for many, many years. And it does work, as one might expect it to.
That's crazy. I didn't put that correlation to that.
Nobody does, because you think a bone marrow transplant, is just doing something with your bone marrow.
Right.
But that's what's in your bone marrow.
All right. Well, this question, I don't even want to read because it makes me think of myself, but how often do allergies change? Is it possible for people to beat allergies?
Yeah. So in talking to patients forever, as I see it, in my entire existence as a physician in 39 years, some people come in, we test them for allergies, and they have a food reaction, a few foods, a bunch of foods. They take the foods out, the antibodies go away. They could have that food once a week or so and not get into trouble because they're not having it often enough to create or provoke your body. So that can change the mechanism. If they start eating those foods every day, it may come back. But some people, as they avoid for months, that makes the problem change enough so that they're fine. And then down the road, they may be able to have those foods here and there. There are some people that have inhalant allergy or environmental allergies, and some are mild. And those people over time may start to see that dissipates, where it kind of gets better on its own. That's relatively rare. There are some people that have fixed allergies to certain foods where if you avoid them, you'll do better. But if you try to eat them again, the problem comes back even if you have a little bit of it. So those you have to keep out for a longer period of time. There are some other interesting scenarios where women who get pregnant, who had horrible allergies before becoming pregnant, allergies are gone after pregnancy. There's no more reaction to foods, no more reactions to dust, molds, and pollens. And I don't think traditional medicine or anyone really understands how that happens. And the opposite, women who have no allergies become pregnant, then the allergies start to kick up. So it's hard to understand how that can happen in both fashions, but it does exist. I think that when you look at your immune response, you don't want to waste a lot of immune response on allergy. I think if you can find that a person's reacting to a food, take them out. Why waste all that? If they're reacting to trees, grasses, weeds, molds, test accurately via skin, and we put a couple of doses of an allergen on to see where a negative skin test occurs initially. First positive skin test is your threshold. If we need to treat that allergy, we'll give you a dose that's below your threshold so that injection doesn't provoke you. We might also do sublingual therapy, where you take drops of the allergen liquid under your tongue instead of doing the shots. So that can work extremely well. But it's a different mechanism of testing and treatment than what traditional doctors do.
All right. And Instagram, is it true that different blood types respond differently to different foods? I have a corn intolerance, and other people I know who have it too have the same blood type as me, O negative.
I don't think that there's a correlation with that. And there's been a book written by a gentleman, I think it is Dad, that talk about blood type diet. So if you really look at this, as I've done over time, there are certain blood types that you're supposed to be able to have carbohydrates and, eat grains and stuff. But if that person's diabetic, that's not going to work. That doesn't make sense. If that person's overweight, that's not going to work. You're putting something on board that's already a problem for them, and that could make it worse. There are a lot of people out there with type O and various types, blood types. I don't think that a blood type can control what you should or shouldn't eat, because a blood type doesn't control allergy. If a person's allergic to certain foods, then they can't have them. Doesn't matter what blood type they are. So I don't think the science is accurate in that realm. I'd rather learn about what your body's doing, do a screening or testing for allergy, look at the entire picture, take certain foods out, look at correcting vitamins, minerals, and hormones, and stop the process from occurring. And with all the patients I've seen in all these years, we've done extremely well learning about your body first and then putting together diet recommendations and proof before and afterwards, with blood work before and blood work afterwards. So remember, there are lots of books out there talking about what you should do that the authors know nothing about you. Some of them are not doctors. They can't examine you, can't do blood testing. So selling a book is selling a book.
All right, this is a good one from Rumble. Is there such a thing as anti-vax drops? My friend claims she gets anti-vax drops from a holistic doctor, and she gives them to her children after getting vaccines.
No. This is a tough one. There are people on both sides of this discussion. People that think vaccines are unbelievably safe, and people that think they're not. There are people that question why every year in September we seem to have a new flu bug. And when that bug is here, some people think, wow, how do they already have 330 million vaccine bottles to give people shots if we just found out the name of this bug? I remember reading a Newsday article years ago that said, it was maybe 5 or 7 or so years ago, whatever it was, well before COVID, it said that, well, the bug that's here is not covered by the flu shot. So the question was, why take the flu shot? You have to do some research, think about this long and hard, understand what's occurring, understand the risks. Doctors need to give people very, very good and clear advice and consent, and need to explain all the potential side effects to things. It's believed that didn't happen this time around with these injections that were given in 2020. So there's a lot that needs to be understood. There are doctors like McCullough and et al. That talk about using things that decrease the progression of the spike protein by using a combination of things, quercetin, nattokinase, curcumin, vitamin C, a combination of things. And I would believe that person because I think he's got more experience and more knowledge than almost anybody on this. So I think it makes sense that with the nattokinase, you're decreasing the ability for clot formation and these clots to occur, maybe decreasing the risk of myocarditis. But these are things that you could look up and comment on. In many circumstances, I don't take a side and tell people you have to do this or that. The only thing I tell them to do is you have to read and learn and make your best decision upon that. So because there are a lot of things in vaccines, and you could find a list of what's in the vaccines, there's nothing you could take that would stop those things, aluminum, mercury, etc., from being or affecting your body. The other last comment I'll make about this is that when I was a kid, there weren't that many vaccines. And there were really no vaccine reactions, except a sore arm. Doctor may get a kick in the shins if he foolishly stood in front of the patient giving him a shot, that sort of thing. Now, look up how many vaccines are recommended for kids. Look at the difference. And look at this other scenario of problems that we're seeing. So, look, read, learn, research. You'll start to understand.
It's okay. We're safe, Doctor. We're on Rumble today.
Good. Good.
All right.
We love our Rumblers.
Oh, yes, we do. All right. We got another one from YouTube. This question. Doctor, I gained 15 pounds 5 months ago. I physically look slimmer and my clothes are fitting like they used to, but my actual weight, like the number, hasn't changed. How is this possible?
Some people that are doing exercise will put weight on in muscle. And conversely, people that do exercise, if they're keeping their carbs down, they're burning the fat, so your fat percentage comes down. But in doing that exercise, you may raise up some muscle density from the activity. So although you're losing pounds and inches of fat, you're going to stabilize some of that weight in muscle. So it depends upon, how can I describe it? Some people are just at that point to burn the fat, burn the sugar, burn the cholesterol, but they need to go a little bit lower on the carb, but a little bit higher on the intensity or the duration of the exercise to get that desired result. Some people have hormones that are low, and the hormone deficiency or decline is holding them back from getting that result. So it's a matter of learning about what your body's doing and then putting together recommendations to correct that.
We got a response. They said, I have not been going to the gym. I do not do much lifting, so I don't think it's my muscles.
It may not be. Again, I can't see you. I haven't examined you, so I know nothing more than what you've said. So it's hard for me to tell you exactly what's going on without looking at that. There are different shades of gray. There are many colors in the spectrum, and meaning that some people burn fat well, some people don't, and that could be hormone related. Some people do a lot of exercise, some people don't. But your body composition can change depending upon, what you do. Granted, I see more people that want to lose weight, burn fat, and get leaner and become more fit or increase their muscle size, etc. So it really depends upon the parameters, your hormones, your vitamins, your activity, and what you're eating. Is he trying to lose weight, or what's the goal?
We'll see the response. About a 15-second delay, so we'll see if they're still active.
Usually trying to lose the weight, you drop the carbs to 30 grams a day. You do a half hour to 45 minutes of exercise every day so that your body's heating up and your muscles are sucking up that fat as a primary fuel. And correcting, nutrients are also important because nutrients and vitamins are food for your cells. Correcting hormone decline makes all the sense in the world, and that's where you achieve your best result, when your body has all of these things working all at the same time.
All right, they haven't gotten back to us yet, but we'll always come back.
Yep.
What do we got?
888-420-9272 if you'd like to call or send us your message, email, text. We'll
I
chat.
see it. I was finding it. Okay. I'm 56 years old, female, and I believe I suffer with candida overgrowth. What are the main causes of that, and what are the most effective ways to treat and prevent?
Well, yeast-related issues, whether they're gut or, vaginal or skin-related, occur when your body can't knock out a bug that it should be able to knock out easily. These are not deadly bugs, but sometimes people have too much carbohydrate in their diet. All that sugar causes these creatures to grow, and some people get them in between their toes, fungal toenails, the list can go on and on. Some men and women get it under their arms, below the breast, so it depends upon the circumstance. But usually it means your immune system needs to do a better job at killing things. So there's a comment that I make, and we could talk about one bug or another or a virus or any bug that your body could be fighting. Why is it there? Your immune system couldn't kill it. Why couldn't it kill it? Maybe your immune cells are low. Why are they low? Maybe because your vitamins are low, and maybe you're not doing exercise. Why are your vitamins low? Maybe you're not taking them, or you're taking them and not absorbing or digesting them. So all of these steps play a role in that end fact of having that fungal or otherwise infection. So we have to look at all of that. We could also do skin testing to test the severity of some of the fungal infections, etc. So that can give us extra information that we may not get otherwise. But you understand the thought process. Why are all these things there? We have to go back to the earliest part of the problem and fix all of those. That's how you get your best results. Low-carb diet, taking nutrients can help to inhibit those organisms. Acidophilus, again, a variety of things. Glutamine for the gut. Some people take a teaspoon or tablespoon of olive oil every night when they go to bed. That's good to help to kill infection in the gut, including Helicobacter. So there are lots of different things that can be done depending upon what we find.
The olive oil can't be mixed with a piece of bread, though. It has to just be olive oil.
Just olive oil. Because the bread would be counterproductive because it would feed sugars, etc., and foods that break down as sugar feed those organisms. So, yeah.
So we have another one. Why do they make babies get a vaccine for hepatitis C? It's a rumbler.
It's a very, very good question. A newborn baby, in the history of the world, how many newborn babies are exposed to hepatitis C on the day they go home from the hospital? None? I don't know. I don't think it makes sense. I wouldn't do it.
Could could it be transferred from the mom? Like if a mom has
You'd
it?
know if the mom had it.
Right.
But, if the mom had it and has made her own antibodies to it and the baby is taking the mom's antibodies, that's the scenario. But vaccines, why do they want to give 70 vaccines to kids now when that was never, ever done before?
Right,
I don't see a reason for that.
Yeah, it's like the baby came out of the woman.
Right.
So how would that be an argument?
Yeah, I don't see why a baby needs a hepatitis vaccine at birth. I don't see why. Or I don't see why kids need 70 vaccines.
Crazy. All right, on to the next. It's getting hot in here. All right, when should I go for my first endoscopy and colonoscopy?
Usually the colonoscopy had been recommended at age 50 for the first time. But honestly, if you have any symptoms and you're close to that age, and I think they've lowered that age now to 40, which I think makes sense, why not do a test to see what the lining of your bowel looks like? We like doing stool tests for looking at components and see if there are things, bacteria, virus, parasites, whatever, in the bowel. Why not do that colonoscopy at 40, or if you're symptomatic, earlier? Endoscopy for the stomach, it depends. People that may have symptoms, if they're persistent, unrelenting symptoms, then it makes good sense to do those tests. I'm a fan of doing the testing because I want to be able to see if there's something going on that you can't see otherwise. Just like MRIs for joint damage. X-rays don't show you the entire joint. They show you the outline of the bone, but MRIs show you ligament, tendon, cartilage, everything else. So it depends upon a person's presenting symptoms. If a relative has a history of a bowel cancer or a bowel disorder, then yeah, you start those sooner. If a relative has a history of stomach cancer or ulcers or polyps, you start those tests sooner. It's always smart. Do the extra test. I can tell you 1,000,000% when I've done extra tests, we found things that patients never knew they had and would never have otherwise understood. I saw a lovely patient today who had some headaches and they became very severe, and her doctor said, you know what? Some may be coming from your neck, some may be coming for this or that. Let's just get the extra test done. And they did the extra test and they found a tumor. The tumor was removed, thank God. Young lady's doing well, but you don't do the extra test. You're missing, a lot of things, and I worry about that. I think the extra tests need to be done.
We have a follow-up with I'm a 29-year-old female, and my grandma passed away from breast cancer. My mom has been checked and doesn't have the gene, but has to get checked more frequently because she is marked as a potential risk. I asked my gyno when I should start getting them, and she said at age 40. I feel like that sounds crazy? ?
So mammography is somewhat painful, a compression and radiation of breast tissue. There's another test that has no risk, no side effect, and has been shown side by side to be more accurate than mammography. It's called thermography. It's a picture of the heat, the temperature of the breast. Because when cancers of the breast start, more blood vessels will grow to feed that tumor site to get more glucose or sugar to make available to the cancer, so it has more glucose so it can make cells grow faster. This is just a fact. And some of this research goes back to Otto Warburg, who was a genius back in the 1930s, who discovered that glucose was the primary fuel to make cancer cells grow faster. The Warburg effect. Genius. So when you look at 10 years of side-by-side mammography and thermography, and mammography picked up abnormalities before, thermography picked up abnormalities before mammography, that further shows you that it's a very valid test and maybe more important than mammography. So thermography, thermography. You're sitting there, nothing on top, and it takes a heat picture of the breast. Nothing touches you, no risk, more accurate. So that's by far the best test to do.
We got a question about, is it true that about this AI being able to detect cancer earlier, or is this just another way for them to watch us?
It's hard to say. I can't comment on that 100% because I haven't looked at every component inside and out of what they're talking about with AI. I use AI when I see my patients, and it took me a very long time to be okay with doing electronic medical record because all of the programs that were out there were not good. And I was still writing in my charts, and I've got many thousands of charts in the office. And, it was difficult. But then I found a company that makes a really good electronic medical record. Patient Now. I have that in my laptop in my office. I walk around, sit down, click. Without the AI, I'd have to type, and I can't type terribly well at all. Blink, blink, one finger at a time. But Freed, F-R-E-D, AI, is one of maybe a dozen or two medical AI companies that when I sit with the patient, I turn on the microphone, we have our discussion, it creates a perfect medical note. So the medical note, first big paragraph is subjective, what the patient says. So the actual note may say, Mrs. Jones came in today with back pain radiating down the right side. Occasionally she has numbness and tingling in her feet. She also has high cholesterol. Brrr, everything that the patient says.
Crazy.
And it's taking the patient's words to make it into that component. Now let's say I ask her questions. That's included. Let's say we had blood testing done a week before. Now we're reviewing the blood test, and I'm looking at that, talking to the laptop. It's recording my discussion of the blood work. And then when I make suggestions and recommendations for another blood test or this or that therapy, it includes all of that. So subjective, objective, assessment, plan, we call it a SOAP note. It makes the perfect note. I don't have to write. I don't have to type. So at the very mildest form, this works brilliantly. Are they going to use it for research to be able to cull information from all over the place? Yes. So I feel that the individuals that are creating this AI mechanism, as soon as they can perfect that into being able to gather a lot of information about specific medical concerns or disorders, we're going to have a lot more information at our fingertips. One of the PA students, and I used to have PA students and medical students come into my practice every month for years. It's a little bit difficult because you have to stop and explain everything to students, but I want them to get an idea as to what I do because nobody else does it. And they want to hear about stem cells, and they want to see about vitamins and all this. So bring them in. One of them, this young girl, Ella, who came in a while back, was one of the first ones to tell me about Freed AI and show me how it all worked. And it was amazing to me when I said, okay, give me a 2-minute discussion on vitamin D and tell me how it decreases the risk of different cancers, and I want medical citations for each. So she typed it in, pressed the button. She said, okay. As soon as she hit, enter, it was done. Milliseconds. She handed me her laptop, and I read, vitamin D, also known as the sunshine vitamin, decreases the risk of breast cancer, studies at Mayo Clinic. Blah, blah, blah. It went on and on and on and on. And I just was amazed that it didn't take longer for that information to become immediately but perfectly outlined. I looked at each of the studies. I clicked on it to read it. It was perfect. So there's a lot of wonderful things that some of this AI and some of this, the new technology can do. I'm just excited to wait to see how this enhances our ability to understand how better to deal with disease. Like yesterday, we spoke about a new type of MRI that goes beyond the basic to look at multiple angles to get a better view of whether cancer has spread or not. It's genius. So let these genius people run with it, and let's see how much benefit we can get to the population. I think it's very important.
All right. On to TikTok, finally, joining. I started birth control and had blood work done, instructed by my OBGYN to see how I'm adjusting. My adrenal levels appear to be low. What exactly are adrenal levels? Could this be the birth control?
So adrenal hormone, DHEA, dihydroepiandrosterone, is a stress hormone. People that are under a lot of stress will use it faster than they could make it, and they feel anxious, irritable, not so good. For some people, we give them a little bit of DHEA, and that bounces back and helps to regulate their stress. Interestingly, DHEA in older population may also make some of the gray hair turn dark again. So we've seen that happen. If you're on OCs for a while, you're telling your body not to make the estrogen progesterone because you're getting them from the pill. And DHEA and estrogen, progesterone, testosterone have a little bit of a connection. So women that go towards menopause that have a decline of estrogen, progesterone, and testosterone, and if they're FSH and LH, which are the hormones that tell you to make your own estrogen, progesterone, testosterone, are going up a little bit, sometimes all you need to do is give a woman DHEA and it balances the others out, and that's all they may need as they're going into perimenopause or menopause. But as that continues to happen, then sometimes you need a cream or a capsule or even pellet therapy under the skin for the hormones. So it depends upon where a person might be. Whenever I see a patient, new patient, old patient, and we're going over their good big blood test, we always look at DHEA. So every patient I've ever seen over time, I've got multiple tests for DHEA, IGF-1, the active component of growth hormone, vitamins. So I could look at trends. Another major part of what I do is look at trends. If you bring me copies of the last year or 2 years of blood work, and they've done some of the things that we want them to do, many times they don't, we can watch to see what your hormones are doing and how you're starting to decline. So it depends upon age. It depends upon how long a person's on the OCs, the oral contraceptives. So there's this, finesse and the art and science mixed together to be able to understand what's occurring.
Oh, they have a follow-up, same person. Do you think birth control is linked to cervical or ovarian or breast cancer?
That's hard to say. I think there are many, many women, maybe millions of women worldwide who've taken the oral contraceptives, and I don't see a direct link to breast, cervical, or ovarian cancer. Not that I've looked and done my super search on Google Scholar to look at any of this information, but I'll do that today as soon as we're done here. Maybe comment on that Monday. Cool thing that I like to do is I'll think about something and then just look at research, and I'll do it at home. I've got my little iPad mini here. I've got my iPad Air on my kitchen table, got my big computer at my desk in my bedroom, have the computer in my office. So anytime something pops into my head, I'm like, let me look at that. So that's what I do, and I'll do that. So if we can find anything that's pertinent to that, we'll give a little shout out on that on Monday.
Yeah, similar question. Probably another one we'll have to follow up on, but it says I've recently seen that the major tampon companies are being sued for toxic chemicals. So
that's
great.
No real surprise here. You could look at every product you come into contact with. Everyone's heard that Roundup, that spray that's supposed to kill all your plants and weeds, is linked with a few cancers. But it's still there on the shelves in stores. I don't get that. I guess paying out literally billions of dollars, in claims that have happened is just a fraction of the money that's coming in, so they're not really worried about it.
Yeah. Quick Google search. Tampax Pearl tampons contain lead. Class action claims. This is from August, this last August.
All right. Now you have to do a deep search on heavy metals and tampons and all of these things, because then that increases the list that I have to tell patients about with heavy metal exposure. So if a person said, well, I don't get exposed to lead, and they're drinking water from plastic bottles that may have sat on a dock somewhere out in the sun and metals are leaching into the water, because we've seen that and literature says that. If now we're going to talk about lead, in tampons.
It's crazy because once you look, it's like, oh, it's owned by Procter and Gamble. Okay, all the aluminum, deodorants. I
would love people, and I tell people all the time, get on the internet, do some research, if you think that there's an issue, research it. A lot of my patients come in and hand me articles. I love it. But, yeah, I'm never surprised anymore about contaminants of things that we eat and that we use every day. Because the powers that be have this wealth that, they can get around and get through anything, especially if they pay off politicians. So, yeah, you have to be very careful. And maybe it's a great idea that I tell everybody, get online and look to see what the safest and most reliable tampons are to use.
All right, I just found a study. Thank you, AI. Recent studies have detected trace amounts of heavy metals, including lead, arsenic, and cadmium, in various tampon brands. For instance, a 2024 study analyzed 30 tampons from 14 brands and found measurable concentrations of 16 metals with non-organic tampons, showing higher levels of lead in organic tampons, higher level of arsenic.
That's just bad.
Oh, man.
So, as I say, if we can get people to read articles like that and get away from those products that were tested and find products that are safer, you got to do it. Wow. Now, I don't know whether that may hold true with other devices used, pads and things, but it's pretty scary to put something in your body that's going to leach lead into your body. Well, look at what happened many years ago when I used to watch the news in the morning. I don't anymore, because I have two big dogs that I have to deal with. When I wake up, they wake me up.
Sounds like a less stressful moment.
Yeah, you know what? I don't like watching the news. There was a program on Channel 4, I think it was Today Show, and they were looking at heavy metals in makeup. And this has been ongoing for many years. And how many of the better lipstick and makeup types, foundations, blush, rouge, all these things that I know very little about, how many of these things had heavy metals in them, and those were the components that made them last longer and made them stay and look better and be stabilized. Or the lipstick, when somebody kisses you, it doesn't come off. So you have to look at that. Years ago, I did a search, and I found there's one company, and they spell their name funny, Bare Essentials, ESCENTUALS. Sabrina, can we get a little help here? Is that how you spell it?
Look at the mic.
Bare Essentials.
Yes, Bare. Oh, are you talking about Bare? No, Bare Essentials. Yeah.
That have no heavy metals in their makeup.
Yep.
So, look and learn. I'm sure there's a lot of women out there listening.
She's about to order.
Look at all the products. Look at all the things that you take and search whether or not they have heavy metals on board. If that company, you like the idea of not having the heavy metals on board and you research it, then use that company. And find other personal products that don't have that stuff in it.
All right, big question from Reddit. My dad is generally a healthy guy, mid-60s, and used to go to the gym every morning, walks after dinner, and played badminton 1 to 2 times a week with semi-professionals, but he has osteoarthritis in both knees. Mm-hmm. I think one is worse than the other. He's extremely reluctant for surgery because he will be off his feet for a long time, and the man can't stand the thought of being off his feet for that long, and I don't blame him. He really doesn't want to go under the knife either. I've suggested stem cells because I know someone who is having treatment for rheumatoid arthritis, and he's seen positive effects. Should this work for him?
Stem cells are ideal in that circumstance. I don't think anybody wants to rush to do surgery for both knees, although some people have because they believe that the doctor gave them the best information for that, et cetera, et cetera. My best comment is to get an MRI done so we could see every component of the joint, not just the outline of the bone, ligament, tendon, cartilage, meniscus, everything. Medial collateral, lateral collateral. Here's our lovely knee. And palpating the knee is nice, and you can feel and create some pressure that might elicit pain, but it's nowhere near as good as the MRI. The cruciate ligaments crisscross inside the knee, hold you front to back. The lateral collateral, medial collateral on the sides, etc. So, got to get the MRI done, and I always want my patients to have MRIs so we can see the entirety of the knee and see what we're up against. And overwhelmingly, Patients that do stem cell therapy, where it takes a minute and a half to extract your own stem cells, spin them for a half hour, inject them back into your knees, they're all done within about 45 minutes, and you've got the best cells in your body, like Superman cells, to go where damage and degeneration is, to make brand new cells. They become, brand new cells of that damaged type. That's called differentiation. So that would be the ideal. We've done tons of it. Thousands of treatments for joints, for MS, Parkinson's, Alzheimer's, stroke, macular degeneration, COPD, pulmonary fibrosis, liver, kidney, heart failure, diabetes. The list goes on and on.
Okay, we have this one. Hey, Doc.
Also, should tell people to look at the website because the videos there are great for STEM. drcalapai.com, drcalapai.com. We should put up the website on the...
Yeah, I'm going to add that to our graphics. So we have this one. Where is it? Okay. Hey, Doc, I've been seeing people promote chelation therapy to remove heavy metals from the body. Is that a legitimate treatment?
Absolutely, positively. So I've done this on my patients since 88. So that's, a long time, 37 years. So it does work. I can tell you that what we do is maybe different from some other doctors. So when patients come in and we do the big blood test and we look at everything, and part of that big blood test has heavy metals in it. We'll look at 5 metals in the blood. That's all the blood labs will do, 5 metals. We'll then do a urine test that looks at 21 metals, and that's a reflection of what's leaving storage, whereas a blood test is what's free-floating that hasn't gotten into cells or gotten stored yet. So in doing that urine, we could see what's coming out of storage. The next step, if we see those, and we always do because adults, even teenagers can have lots of these things on board. The longer you live, the more you may have, obviously. We do the IV with the calcium EDTA. It binds to those metals, doesn't let them go, and then pulls them out into the urine, which we capture after the IV. So you can do a 12 to 24-hour urine after the first IV and see what we pulled out, which usually, on a cool, colorful graph chart, shows metals coming across the page. So the second most important part about chelation, besides grabbing and pulling out, is that if you do 10 treatments, and at the 10th treatment we repeat that urine after that IV, now you've got 2 different IVs to look at. The first one with 1 chelation, the second one after 10. So now you can see what you removed. And you could look at the first and the second urine and say, wow, the lead is mostly gone, or the arsenic is gone, or this is very low, the gadolinium. So it can prove how well you're removing these things. And that proof is a super important amount of information. That guides us to how many treatments a person might need, but there's proof you're removing them. Now, as a second comment, for many years, there have been people that try to detoxify. I'm trying to make a funny face. The body by using oral liquids, vitamins, saunas, any number of combinations of things that don't really exist in what I would call the scientifically proven medical realm that I like to talk about, like I just mentioned with looking at the urine to prove the metals are being depleted. And they'll do all these things and come in and say, well, I chelated for years. I did this, 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 and this. And I said, well, did you ever test to see whether the metals are still there or not? Oh, no. Because they went to a non-medical person or they heard something and found something, read a book. Then I said, okay, let's do 1 or 2 things. Let's just look at urine to see if there are metals coming out. You could do that simple urine test. Just give us some urine, we'll send it out. Or if you really want to get a good picture, let's do the IV and the urine afterwards. If what you're saying has worked, you'll see nothing coming out. If it hasn't worked, you'll see some or a lot coming out. And every single time I've seen patients that have tried all these things, chlorella, spirulina, zeolite, blah, 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 we still see a ton of metals coming out. So that proves to me that those things don't have that effect. I've seen patients that have done chelation with me when I had my city office years ago, have come back, they want to do it again. And the levels weren't much different once we got the majority of them out when they wanted to come back in and do it again. Because we know that if over time we're depleting these things, it'll take a lifetime to put those metals back to where they were before we treated you. So we've had patients that have done treatments over time, and you retest them and they're doing really well. They're not exposed to those things in the numbers that they had that took a lifetime to get there in the first place. So I like proof to show, hey, this is the proof. There are foot pads and foot baths. I won't even talk about those things for detoxifying. So
I may have gotten bamboozled back in the day.
So, people market and sell these things, and patients will do it because it sounds cool. But when I say, what in that foot pad or what in that foot bath water, what's in it? And what are they saying it's pulling out? Give me a name of something, give me something to hang my hat on. What are the toxins they're pulling out? And then test the water to see what's in it. There's just no such, evaluation. So I think it's a waste of money.
Just like my 3 years of pH water. Don't get me started.
There may be some significant risk with...
Oh, come on.
I'll give you one little tidbit, and this is for the audience as well.
You're telling me it could be detrimental?
Could be.
Great.
So people don't realize that the acid-base values of your blood are strictly controlled, millisecond to millisecond, by your lungs and your kidneys. So for sake of discussion, if you eat salad with a lot of vinegar in it, vinegar is acetic acid. That hits your stomach, some of that gets in your blood, your body immediately pushes out acid in the urine. So you're balancing that pH exquisitely, in a perfect fashion. If you try to drink or take in things that are more alkaline, higher pH, your body holds on to acid to keep your pH at exactly the same level in your blood. You could never be alkaline for a minute, much less an hour or a day. There are certain circumstances when your body is so messed up, diabetic ketoacidosis, respiratory alkalosis, your body is in really bad shape and you may not be around much longer. But that's when that whole mechanism that's exquisite in everybody's system, that works, your entire life, every millisecond, is distorted. So it's using these things and spending a lot of money on some of the machines that make you think that drinking alkaline water is going to change your life. It's not really a thing. Also, when a cell becomes a cancer cell, it's mutated, and now it has the desire to get more glucose to grow faster. That glucose is broken down inside that cancer cell for energy, for fuel. It makes lactic acid. Lactic acid, if it gets pushed outside of that cell into an alkaline environment, which happens because the acid can go to alkaline, acid's not going to go into an acid environment. It's like two batteries of the same charge repelling each other. That acid inside the cell can go out to an alkaline environment and then stimulate vascular endothelial growth factor to get more blood flow back to that cluster of tumor, to create more blood flow and then more glucose to have that whole cycle increase. Would you want to have more alkaline around a cancer cell, or would you want to have more acid around a cancer cell? You want acid. Vitamin C, ascorbic acid, alpha-lipoic acid, those are used against cancer because they create that inhibition. It's more complicated than that, but you have to be very careful with looking at trying to alkalinize. That may be more dangerous than you could realize.
So just a follow-up question from myself about this. When you get like acid reflux and stuff like that, is that kind of your stomach adjusting for the too much acid, or what is that? Is that nothing to do with this at all?
So sometimes it's a reaction to a food. And I can tell you overwhelmingly people that have acid reflux, indigestion, all these odd stomach things, hot burps and all. And we test people all the time with any stomach symptoms for allergy. And we take foods out, that tends to go away. The biggest culprits seem to be the grains. So if I do a consult and person says I have stomach problems, among other things, I'm like, do me a favor. You're going to come back in a week to go over your blood work. Don't have any grains. No oatmeal, no bread, no rice, no pasta, none of that. And just let's see how you do when you come back. Hey, by the way, we're going to get blood work now. How's your stomach? Oh, it's better. How much better? 80%. 80% just by taking out grains. And we didn't even review the blood that might show there's an allergy there. You don't have to have the allergy, but grains are all GMO now. And all the GMO foods are causing more problems than ever before. And you could talk to people. I mean, everybody knows somebody who's gone to South America and Europe on vacation. And when they go there, they can eat what they want. And they don't get bloated. And they can eat the bread, the pasta. I see it myself. I've gone many times, and who doesn't love pasta in Italy or France or some of these places? I have a favorite little spot down by the port in Saint-Tropez. And I walk towards the edge of the port away from where all the big boats are. There's a big seawall there to protect the waves from coming in and hitting the boats. There's a little Italian place called Canistel. They make the most delicious pizzas, pure grain. Nothing else. No GMO, nothing. And they'll make truffle pizza. The first time I had it, I lost my mind. I said, I've died and gone to heaven. But and there were three other restaurants down right in that little area next to the beach that were exquisite seafood, Italian food, French food. And the prices were so ridiculous, I lost my mind. Quick story. I walked down there by myself. I like to travel by myself. No one else to tell me what they want to do and eat and go and blah, blah, blah. I usually go with a friend or someone or a girl, but I walk to this place, and it's French, Italian, and seafood. So I go to the seafood place, and a young girl sits me down. And it's gorgeous out, and it's rustic and romantic and pastel colors and people walking around. I'm totally thrilled. I'm totally happy. And I look at the menu. I'm like, this looks really good. So I had a nice piece of fish, fresh fish. They catch it, that morning. This was lunchtime. And they brought out eggplant done 3 different ways, some grilled eggplant, and the vegetables are exquisite. Everything's organic. And I have this whole meal, and I have a little bit of appetizer and entree, and I had a little bit of dessert, had a glass of wine, so I'm in my European food heaven. I didn't realize the heaven that was coming next. So I think I had sorbet for dessert, and she comes and brings me the check. And I look at the check, and I've got this puzzled look on my face that says, 29 euros. I'm like, 29 euros? That's not a lot of money. So rather than paying and running away thinking that I got a deal, I called her over. I said, I think you gave me the wrong check. She says, no, that's yours. I said, I don't understand. How could this be 29 euros? 29 euros is what, $35?
Yeah, about. Just about.
How is it possible? It was a big serving of food. It was amazing food, the best and the freshest I've had. I said, I don't understand. How is this possible? She said, well, look back there, that street. I said, yeah. The owner of this restaurant owns these other restaurants. He owns the boat where they go fishing for the fish every day. So everything, and he grows all these vegetables at his home. I'm like, oh my God, where does this happen anywhere else? It doesn't. Of course, needless to say, the first time I had the fish restaurant, then went to the French, went to the Italian fish, French, Italian. I just kept rotating all week in those places. It made no sense to eat anywhere else. And some of the other food was even less expensive, 20 euros. I felt guilty. Of course, I gave her a gigantic tip because I was so happy and thrilled and about the whole thing. But yeah.
We may have to meet you in Saint-Tropez.
Oh, you have to. Trust me. Anybody who wants to go, just call Frankie. We'll get a whole group. We'll be tour guides. Yeah,
you hear that, viewers?
It's amazing. It's amazing. So you can go to places that are gorgeous and find these unbelievable meals. You just would never expect it. But yeah, it makes it more fun.
Unreal.
Phone lines are open, 888-420, 9272, 888-420-9272 if you'd like to call in to ask a question.
Oh, we have a question from before. Been a few minutes, but thoughts on nicotine replacement, like these Zyn pouches or other gums?
I think it's a bit of a risk because a lot of people are vaping, a lot of people are using it. And there have been some comments on the benefits of nicotine in certain, medical, scenarios. But the problem is people get addicted to it and then they can't stop, can't get off. It's more and more and more. And then you'll see, and I've seen people that vape and they're just vaping like crazy around the clock. and they're vaping.
This question is regarding non-smoking products to get off of smoking. That's what they say.
Well, if you can get off cigarettes, that would make sense, but you've got to do it for a short period of time, and you don't want to get addicted to that device you're using to get off the cigarettes. Cigarettes got 4,000 chemicals in them, and they're all bad all the time. So if you can use something to get off them, then I think that makes sense. But interestingly enough, we have patients using NAD, nicotine adenine dinucleotide, the injections, which are great for brain function and everything else. They seem to be able to get off alcohol and cigarettes just by using that. And there's a second subset of people that seem to be, and this is in literature, using the GLP-1s to decrease weight and sugar fluctuations. They're also getting off alcohol, which makes sense because the sugar in the alcohol and smoking. So whatever you can do to get away from smoking is probably a decent idea.
Anyone else? Guys, phone line's open. 888-420-9272.
Let's take a couple of emails from the office. Gina has ankle pain, and she feels that her ankles are wobbly. Wobbly means that your ligaments have become lax or stretched out. For some people that are runners pounding on the pavement, the ankle bones, jarring, even if you're wearing great sneakers, will have some effect on maybe stretching or shearing or creating laxity in the ligaments. And then after a while, your foot seems wobbly or floppy. It's not holding position. If the MRI shows that there's ligament, tendon, laxity, cartilage wear and tear, then yeah, we could either do PRP, but more likely stem to make those ligaments, tendons strong again, and maybe do some exercises that are specific to creating stability in the muscles of the leg without a jarring effect, and you can see some great outcome with that. But that's pretty common, and especially within people that are runners. I've treated patients that were ballerinas that have, sorry to say, really bad feet. They kill their feet. You think women who wear tight shoes, they kill their toes? Look at the feet of ballerina. And I understand the necessity for being great at that job. I think it's important, but there's got to be a better way to handle their feet or help
It's crazy.
their feet.
Even Sabrina with the gymnastics and the cheerleading, her wrists are like, been through the ringer, huh?
Oh, yeah. A lot of my buddies in karate class, their wrists are really strong because they're doing a lot of striking, et cetera, and your hands get bigger and your feet get a little bigger. But I remember going to the ballet. It was honoring Jackie Onassis. And a friend of mine who's a publicist, Corey Hayes, a brilliant publicist in the city, got me a ticket to go there. And I took a girl who was a patient of mine who was a ballerina because she had all the ins and I can go and hang out with the cool people. Got all dressed up, wore a tuxedo. Carried a rose, for her. It was really a wonderful evening. So we're watching the whole ballet, and it was amazing. And just the skill and the level of control of their bodies they have is just beyond anything. Wonderful. So at intermission, we walked back to the area, whatever the level was, and we're sitting there and just having champagne. So here I am having champagne in my tuxedo, and it's a ballerina. I look good. A woman bumps into me right next to me, and it's Maria Shriver. I was like, oh, sorry. And then it took me a second, and I'm like, Maria, where is Arnold? Arnold must be next to Maria. So then a minute or so later, Arnold comes walking over. And, of course, I had to say, hey, how are you? So I spoke with him and her for about, 20 minutes, but it was pretty cool.
That's wild.
Pretty cool. One of those memorable things. But yeah, strengthening your joints is important, and maybe more so as you get older, because as you get older and the joints become a big problem, you lose your ability to do your activities of daily living, of your basic functions, your ability to walk and, ride your bike and stuff. We want you to be able to do that forever. Let's see. John has got a pain, and it goes around underneath his rib. And he thinks it happened, from playing softball. Yep, twisting when you're hitting a softball, you're affecting your ribs, of course, and moving your upper body in a rapid fashion, and that could affect the way your ribs attach on the back on your spine. So this, obviously, is a spine with no ribs. The ribs attach at facets on the spine. And they can pop out of position and create pain on the nerve root that runs along the bottom of that rib going around to the front. So sometimes the rib pain is here, but the problem's in the back. It's easy to palpate, stretch, sometimes do an adjustment to take that discomfort down. If it's a recurrent issue, and with some people that play sports, they have this right-sided issue because they're righty, whether they play golf and they're swinging or whatever they're doing, playing ball. Sometimes we'll inject it with PRP to be able to create some stimulus to get the area to get a little stronger and to heal. And of course, we've done it for stem when people have multiple areas that are a problem, but that creates the strength and stability again. Okay, Ted, chronic sinusitis. So chronic sinus infections occur when your immune system can't kill, certain bugs, a variety of bugs. It could be bacterial, it could be viral. It's nice if when it starts, you can come in, we'll get some of that material, the mucus, nasal swab, or you can sneeze it up or spit it up. We send it to a lab. The lab will then take that material, put it on an agar plate and grow it. And then as that incubates, and old-time doctors did this in their office. I mean, this is a long-gone art. I remember going to the doctor's offices and seeing this years ago. And they'd incubate, and then this fuzziness would occur on this agar plate, and they would take these little circular antibiotic-soaked discs and drop them every inch or so on this big plate, and you would see what kills the bug the best. Great idea. Brilliant. Old school. And then whichever antibiotic disc had the biggest zone of inhibition, the biggest area of death of the infection, that would be the best antibiotic to use. So some people have allergies and they're more prone to sinus infections. Other people, their vitamin levels are low and they're not making enough immune cells to be able to fight. So we have to look at the whole picture. And interestingly enough, when we've had patients over many years that have coughs and colds and infections, they come in, do a couple of vitamin IVs, boosts up your immune response, help you get over it, decreases the inflammatory cascade. Some of those people throughout the winter, once or twice a month, will come in for a vitamin IV and they'll say, I don't get those colds anymore. I don't get the coughs, the colds, the sinus, the infections, because the vitamin IVs help to upregulate your killer cells to fight things. And there's tons of research on vitamin C IVs. If you look at Google Scholar, you'll be able to see 1,500,000-600,000 studies on how vitamin C IVs help to inhibit cancer, how they're great to knock out viruses, entero, rhinoviruses, COVID, shingles, Epstein-Barr. Literature's there.
All right, what do we got? Rumble, you're slacking today. I'm just saying. It's not me. It's just the facts here.
No Redditors today.
No, yeah.
Where's
there
our
was
Reddit
one.
people?
There was one early. Let me see. Maybe I was kicked off again. We'll see. All right. Nothing yet.
Okay.
And then
888-420-9272. If you'd like to call in, you can do so now. Covered a lot of good ground. What else did I not talk about? Eating citrus fruits like oranges are tied to a 20% lower risk of depression. Now, I love oranges. My favorite oranges are called Sumo Citrus or Deepakon, D-E-P-A-K-O-N oranges.
Oh, I never heard of that.
They're massive. They have them at Whole Foods from January to April. They're gigantic, like the size of a softball. Their skin is very thick. They have this big bump on top, like the nipple on top of the orange, bigger than the others. And they're delicious, and they're just very sweet. So that's my favorite orange. Yes, a caller. Hi there.
Hello.
How are you?
We're wondering, I have Epstein-Barr virus.
Yep.
I'm wondering if I can spread it to people around me.
Yes. So
How do I do that?
the real discussion of Epstein-Barr is relatively straightforward. It's a virus that persists in your cells, and it also can get your body to keep replicating and shedding more viral proteins to make it continue to happen. You're first exposed between kindergarten and college. And as I read, we did pretty much a big segment yesterday on the show, in the podcast, about Epstein-Barr. 90% of the world is exposed to Epstein-Barr. 90% of the world. This is the biggest virus in the world. Not Ebola, not any of the other viruses. This is the biggest virus in the world. So between kindergarten and college, you get it. You're tired, achy, flu-like. You could have it mild or you could have it really bad. Mild would be a little bit of this or that. Sometimes you stay home from school for a day or two. Other times you get kissing tonsils. The throat is almost closing. Your spleen could be inflamed. And it's a bad bug. Typically, there's no drug for it. With our patients, we get great results by doing intravenous vitamin therapy. And you know that mono, which is Epstein-Barr, is called the kissing disease in kids. Funny thing, too, is that, kids get it, but, adults don't really think much about it. But when the kids come home, they're giving it to the brothers and sisters and parents, aunts and uncles, grandparents. Grandma's tired now. She doesn't want to cook anymore because she's got Epstein-Barr. And that's a shame because you want grandma to cook as much as possible, et cetera, et cetera. So also yesterday we spoke about the fact that you could be a lifetime carrier of this bug, and it can wax and wane. It can start and then go away and start and go away. So it can be there for months, and you certainly can spread it around to other people. So the idea that if we get the vitamin IVs done, we can help to shut it down and knock it down, that's great. But we see this every day. I see patients that have Epstein-Barr antibodies that are sometimes crazy high.
Wow. Okay. Thank you very much.
You're welcome.
Have a good one.
Thank you for the call. You too. So, yeah, it's the most common bug ever. I didn't mention also, I didn't want to scare the young lady, but it's linked with 24 cancers, MS, lupus, Alzheimer's, Parkinson's, ataxia, meningitis, all of these horrible things. We just don't know how long it has to be there to do that. So like anything else, you can take 10 people, 100 people, 1,000 people. And if you track them, some people will get really sick from one bug, and some people will not get sick from that bug. Some people may have issues with their immune response, and some people don't. Some people can smoke to 100 and never have any medical problems. It's pretty rare, but you don't want to take that chance. But, individuality, biochemical individuality controls what your body goes through. But I wouldn't want to be the person who just sits back and lets stuff happen and see what the outcome will be. I'd rather be proactive, strong, healthy, strong, make your body as healthy as you can so that you can prevent diseases and disorders from occurring. You don't want to be the person who has Epstein-Barr and then at some point you're starting to see all these other issues happen. Burkitt's lymphoma, which was found in Africa many, many years ago, was correlated with Epstein-Barr virus. So there are viruses that may be stronger in Africa that are creating the cancer. When I first started looking at Epstein-Barr virus many years ago when I got into practice, and I was getting on what was Health Database Plus, which was a really early search engine for medical information, I had to use this horrible computer that was, the monitor was gigantic and went back like the head of an alien from that Alien movie. And it was a little green screen and the dial-up was horrendous. Boop, 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 boop. You had to wait for that thing to connect. I remember seeing that doctors did testing for Epstein-Barr in women that had breast cancer. And when they took out the entire cancer and took free margin cells out to make sure they got extra tissue, they didn't find any Epstein-Barr in the healthy non-cancer tissue, but 99% Epstein-Barr found in the breast cancer tissue. So Epstein-Barr is linked with breast cancer. Lymphoma, Hodgkin's, non-Hodgkin's, Burkitt's lymphoma, breast, stomach, colon, the list goes on and on. So it's a bad virus. So you don't want to be the person that waits to sit and let something like that happen.
Yeah, you stressed me out yesterday during that show.
Well, a little stress makes people geared a little bit more to learning and reading and looking and, try to really optimize their health. That's the point. Learn about your body, get as healthy as you can be, keep doing all the good things. It's not hard. It doesn't take 1,000 visits. It takes 2 visits. Come in, get the blood work done. We'll learn about everything, fine-tune everything, recheck your blood, and then just put you on a great protocol. It works. All righty. Looks like things have calmed down a bit.
A little bit.
So we can talk about our next program on Monday. we'll get some more interesting research for that. For all of you that like the program, we ask that you send it out to your friends and family. Like and share and subscribe.
And if you're watching on LFA, if you want to see this show, it's also on Monday and Fridays as well on the personal Rumble, the personal YouTube, all the Optimal Health Program, Dr. Calapai.
Terrific.
You can find him on all the platforms.
We also have, and I spoke yesterday to a great doctor, Dr. Borscano, Joe Borscano, and he was one of the best doctors to ever create protocols for treating Lyme disease. And I've known him for many years, back into the 90s. And he created the treatment of Lyme, in 18 different publications that he would send out to doctors to show them how to test, how to treat, how to do this, the whole protocols. And he's helped more doctors and more patients than anybody, in the world. But he agreed in April to come on the show, and that's going to be a great interview. Great
Looking
interview.
forward to that
So,
one.
yeah, can't wait. He's just a terrific guy. So, yep, some great stuff coming up. We have other people we're reaching out to do interviews with, so stay tuned. There'll be some cool stuff. Meanwhile, we'll be back here on Monday at 12:30, and we'll see you then. Bye-bye.